Hi everyone, welcome back. Hope you're nice and refreshed after that. We now turn our attention to spinal injuries for jockeys. The way this will work is our guest speaker has a pre-recorded piece which we'll present to you, and then off the back of that she will join us for a Q&A. So it's about an hour video on spinal injuries and her findings, and then the Q&A will take place off the back of that. The speaker here is Daloni Lucas. We welcome her along. Those UK-based may well recognise her from her work in the UK. She's an appointed therapist at many racecourses across the south, the likes of at Cheltenham, Chepstow, Salisbury, Newbury, Kempton and the like, and is currently a PhD student at the University of Bath. The research that Daloni does is focused on the analysis and prevention of spinal injuries in horse racing. She has worked within horse racing for the past 13 years as a physiotherapist and the former clinical lead for the IJF, that's the Injured Jockeys Fund in the UK. So I'll hand you over to Daloni Lucas.
Thank you for the introduction and for inviting me to share my research with you today, which focuses on the analysis and prevention of spinal injuries in horse racing. The research forms part of my PhD through the University of Bath and is a collaboration between BHA, the British Horse Racing Authority, the Irish Horse Racing Regulatory Board, and obviously the University of Bath. It was funded by the Racing Foundation, which is a charitable organisation. I'm sorry I'm not there to speak with you in person. I'm currently 38 weeks pregnant, and I know there are many medical professionals in the room. I don't think many of you are obstetricians, and therefore decided against travelling. So to give you some background context, we all acknowledge that horse racing is a high risk and dangerous sport, and the high incidence of falls and injuries has been previously reported within the research. Our colleagues from Ireland, Siobhan O'Connor et al., identified that a flat jockey will sustain one fall in every 250 rides, with 35% of these resulting in injury, whereas a jump jockey will experience one fall in every 20 rides, with 20% of these resulting in injury. So falls could be considered somewhat an inevitability and an occupational hazard, but I do feel we have a duty to explore ways to minimise fall and injury risk in order to improve the safety of the sport. Analysis of injury surveillance data held by the British Horse Racing Authority outline that injuries to the head, neck and trunk equated to over a quarter of all injuries reported between 2015 and 2017. These were of course varying in severity from general soft tissue, but also ranged to the more catastrophic and fatal. So whilst we understand that whilst the incidence and prevalence of these injuries is well reported, no previous research has really sought to examine the etiology of spinal injuries in horse racing, so exactly understand the how and the why these injuries occur. So the overarching aim of my PhD project was to identify the mechanisms and characteristics of spinal injury in horse racing, and then use this information to inform the design of any intervention that would minimise spinal injury occurrence. So today I'm going to talk to you about four main studies. Study 1 involved the development and validation of an analysis framework in horse racing, and that was really to facilitate the systematic use of video analysis for study 2, where we look to characterize the spinal injury event and sort of identify what's happening from an environmental and biomechanical perspective. Then the second sort of phase of the project is related more to safety wear. So study 3 looks at the sort of current use of body protectors, and is really an end user engagement where we explore how and why jockeys are doing what they do with their safety wear. And then study 4, we looked to see whether we could quantify what was reported by the jockeys in study 3. So some outputs that I will share with you which resulted in an update to the body protector used currently over here, and also some insight regarding fall mechanisms and potential ways that we could educate and train our jockeys to fall. So study 1 was the development and validation of a video analysis framework in horse racing. And this was really to facilitate the use of video analysis, as there is no current sort of framework that we could standardize the approach of video analysis through. So we had to develop our own. So the multiple phases in the development of this involved analysing the previous published research to see what the identified and acknowledged risk factors of falls and injury were. And then also we established an expert industry steering group, which consisted of many key stakeholders from the British horse racing jurisdiction. This included the Injured Jockeys Fund, the British Horse Racing Authority, the Professional Jockeys Association, jockey coaches from the British Racing School, the British Equestrian Trade Association, and these the beta actually licensed the safety wear. We also included consultant spinal surgeon, academics in biomechanics, epidemiology and injury prevention, and most importantly, we also had 8 professional jockeys on the steering group. Once we'd identified the risk factors from our literature search strategy, we then posed the same questions to the expert steering group. So we asked them what they felt the risk factors to fall and the risk factors to spinal injury were in horse racing. And then we amalgamated their feedback with the search strategy, and then formulated some descriptors and definitions that would describe a fall and what happens sort of sequentially during a fall. Subsequent rounds of the Delphi involved the expert steering group then reviewing these descriptors and definitions and refining them. Now, I'd advise you to, if you've got a smartphone on you, to scan the QR code above my head, as this will take you to the paper that actually has the framework. But I will just briefly go over what each of the analysis phase or subsection includes. So the situational descriptors and definitions that were included in the framework, these relate predominantly to the competitive scenario under which the fall occurred. So, for example, the location of the fall, the surface type, the distribution of the field, the position in the race, so how the horse was travelling. And then the gross fall descriptors, they focus more on the type of inciting event. So was it a fall or an unseat, the number of horse fallers, the number of jockey fallers, and also the sort of more general sort of descriptors in terms of outline body position. So was the jockey tucked or semi-tucked, extended, for example, during their impact. Flight phase descriptors, these are more biomechanically focused, and they sort of capture the characteristics such as fall height, fall direction, the axis upon which axis the actual the fall occurs on, and then moving down to the contact occurrence. This here is a sort of sequential sort of description of how the jockey falls. So, for example, the body part that contacted the impact surface, the intensity, then we capture this then for each body part as they impact the ground or a fence or whatever the contact surface is. The axial skeleton descriptors, these relate more to the orientation of the axial skeleton. So, for example, what position the head, neck and spine were in during each contact occurrence, the orientation of the head in relation to the pelvis, so capturing whether there's any axial load, and we also captured here any head impact variables, so whether there was a head impact intensity, location of head impact, force direction, and also whether there were any observed signs of concussion. And then the final section of the framework captures any information relating to any subsequent impact that the jockey might sustain. For example, if they're on the floor and they sustained a secondary impact of the horse, a trailing horse potentially, kicked them, and what body part that impacted and what impact intensity. But as I said, if you scan the QR code, you will be taken to the link for this paper, and each of the descriptors and definitions will clearly laid out there for you. In study 2, we utilised the framework developed in study 1 to characterise the spinal injury events in horse racing. And the aim here was to identify and characterise the environmental, behavioural and biomechanical risk factors relating to spinal injury occurrence. This was a case control study with a ratio of 1:4. So for every one case, which was somebody who had a confirmed spinal injury, we also looked at 4 jockeys that fell under similar conditions but did not sustain an injury. And both of these groups had to be captured on televised horse racing within Britain and Ireland. The total number of participants was 655. And then we break it down into jurisdiction. We had 400 participants for Britain from the British Horse Racing Authority, 80 of which were cases and 320 were controls, whereas with the Irish data, we had a total of 255, 51 were cases and 204 were controls. This was very much a 2-phase data collection. Phase 1 involving the systematic use of video analysis to actually characterise the event. There were 2 coders in total, myself and a research assistant who is also equestrian background. And I must stress here that we were blinded to the injury outcome. So we didn't know whether the individual was a case or a control, because obviously this would potentially bias our coding and the outcomes of the study. Now, a lot of preliminary work went into this study. So we had to build a coding window. So on the screen there you can see the buttons template that we built around the framework. So instead of obviously having to write, we just sort of systematically go through and click the descriptor relating to the observed action. And this then allowed us to just export everything straight into Excel for analysis. So from a data handling perspective, there was far less sort of margin for error. Because there was more than one coder, we also had to conduct some inter-rater reliability studies. So we used a subset of the data and analysed the video footage twice, and we compared our results. And what we were looking for here was consistency in responses. And for both inter and intra-rater reliability, we had almost perfect results. We also asked an expert jockey coach to analyse the same video footage, and again we had very high inter-rater reliability with that, so indicating that we were, coding along the right lines. And phase 2 of the analysis then involved the epidemiological analysis of injury surveillance data, so medical records, and databases held by the IHRB and the BHA. These databases and the sort of information that we captured from this epidemiological analysis was more related to the intrinsic and extrinsic risk factors that we couldn't acquire from video footage. So for the jockey, for example, this was related to their age, their sex, their license type, claim, previous falls, previous injury history, also what injuries they sustained concomitant to their spinal injury, and sort of any relevant sort of injury history within the previous 12 weeks, as well as any concussions that they might have had prior to their spinal injury. Then we also got some specific event variables, for example, the going, which we couldn't capture from video, the distance covered prior to fall, the race class, and then specific variables relating to the horse, including their age, their sex, their fall history, and also whether or not the horse sustained an injury or fatality during that fall. So when we consider our results for this study, the demographic characteristics of the 131 injured jockeys, the average age was 28 with a range from 17 to 52 years old. There were 115 male jockeys and 16 female jockeys that were injured. And then the distribution there of jockeys per license type, 72 being professional, 6 were apprentice jockeys, 45 were conditional jockeys, and 8 were amateur. And then when we also consider the injuries that were sustained by body part, 24% occurred at the neck or the cervical spine, 59% occurred at the thoracic spine, so the middle of the back, and 17% occurred at the lumbar spine. We did not have any sacral injuries. Now, as you can appreciate, the video analysis and the epidemiological analysis combined really created a significant number of variables, and we weren't able to just run a sort of simple linear regression on these because there was a bit of a mismatch between the number of variables and the number of participants. So we had to use a variable selection technique, which was a machine learning algorithm known as random forest. And random forest is a sort of data science approach that essentially looks at a number of decision trees, which looks at the relationships between each of the variables, with the outcome being either injured or not injured. And from this, we were able to identify the most predictive variables to then run subsequent multivariate generalized linear modeling, which is something I'm still working on at the moment, specifically looking at the relationship between the variables and how their relationship might impact spinal injury risk and their odds ratio. So this is purely a data-driven approach to identifying the best predictive variables. So these are essentially the fall characteristics and the risk factors that were the most predictive of spinal injuries. So you can see they're the top 8. So I'll just give you a moment to read through them. But interestingly, 3 of the variables relate to head impact. So number 1 being head impact intensity. Number 6 being head impact location. And number 8, the second impact location, the most frequently observed second impact location, was the head. Just to clarify as well, second impact intensity is the second body part that impacted the contact surface. And what we observed predominantly, and I'll just play this video so you can visualize as well, is that often the first body part to contact the floor would be the jockey's hands or periphery, followed either by the head, neck or torso, as observed here. So this is going to play in slow time as well. So just while they're approaching the fence, self-explanatory, head impact intensity. A high head impact intensity was the most predictive. A sudden landing deceleration was the second most predictive variable. The third, as I've just explained, was the second impact intensity, so not the hands, it tended to be more the torso. The fourth predictive was the axial skeleton orientation. So when the pelvis was directly above the head, this is more your axial load through the spine, as observed there. A field size greater than 8. And then the sixth most predictive was the head impact location, so anterior or top of the head. Then the seventh was whether the jockey was tucked, so is that gross position during the impact. And then the eighth most predictive was the second impact location, which was often, or the most often, was the head. So to build on the first two studies of my thesis, we also have a postdoctorate employee, James Cowburn. You can see his picture there. And he is very much working on the computer simulation of these falls. Obviously, we are unable to expose jockeys to the same mechanisms that result in injury, and therefore we have to simulate them on computer. So his work, his aims for his work are really to determine whether there is an optimal fall technique that would minimize the risk of spinal injury during falls, and also use this information to help the design of any protective garments that might reduce that risk. So his two main objectives for his work were really to estimate the internal spinal loading during the fall conditions, again via computer simulation for reasons I've explained. So this is really looking at the failure threshold of the internal structures. So how, what happens, so when they actually get injured, and then also to identify the mechanisms for injury related to those different fall conditions via the computer simulations. So the key thing with this is that with a computer simulation, you can really look at how the internal structures behave at the point of impact and beyond. So phase one of James's work is to utilize the fall mechanisms identified from the video analysis study and then replicate them using the computer modeling and the computer simulation, and then to validate this framework to be able then to quantify and estimate the internal forces and the failure thresholds. So this is where we're really sort of going with this, because we can't, as I said, expose the jockeys to the same injurious mechanisms. Now, I think when we went into this study, we hoped we would identify some relatively straightforward and modifiable risk factors. But as you can see, 7 of the 8 most predictive relate to the biomechanical characteristics of the fall. So I think, we've done what we set out to do with this study, but perhaps the results were not as easy to do something about as we had hoped. So we are also looking, going to look for a more applied approach and engage with our CMA, our Chief Medical Advisor, Jerry, who's in the room, not this room, to see, what, from an applied perspective, what variables we can easily manipulate to reduce injury risk. So whilst the main focus of the research is spinal injuries, it's clear from the results that 3 of the main sort of predictive variables of spinal injury also relate to head impact. And when I've looked at the results and all the data related to head impact, I discovered some sort of what I thought were quite alarming figures, and I wanted to share them with you. Specifically, out of the combined cases of control, of which there were 655, 541 of those, which is 82.6%, sustained a head impact during their fall. You can see there they were of varying intensity. Now, these impacts were, as I said, subjectively measured, therefore an analyst viewed the video footage and made the decision whether they deemed the impact low, moderate or high. And this is an approach that is commonplace amongst video analysis in many other sports where there is an absence of any objective means of quantifying head impact intensity. So when we delve a little bit deeper into the comparison between cases and controls when it comes to head impact occurrence and head impact intensity, you can see there that the cases experienced a higher number of head impacts. However, when we look at head impact intensity, there is a clear difference between the cases and the controls, with 83.9% of the cases sustaining a high impact compared to only 9.6% of the controls sustaining a high head impact. Now, I think this sort of raises the need for us to investigate head impacts further, and also with the shortfalls of subjective head impact analysis, it does also call for us to more objectively measure these head impacts and sort of look at the implications on jockeys' health and well-being that this obviously has. Now, the next two studies within the thesis are focused on safety wear, more specifically the body protector. And to provide you with some background context, I'm just going to talk to you about the testing and the licensing of the garments. Now, the body protector is predominantly designed to protect the torso against blunt, non-penetrating trauma. So this is to protect your internal organs from visceral injuries that can be fatal. But the garment also should offer some protection from transverse fractures, so from a lateral impact to the spine. Now, from 1992 onwards, the garments have been licensed and the standards have been set by the British Equestrian Trade Association. Now, BETA, in order for a garment to be compliant with the standards set by BETA, the garment needs to cover set areas of the torso and also undergo annual batch testing, and then also meet one of the 3 levels of protection outlined by BETA. Level 1 offering the least amount of protection, up to level 3 offering the most amount of protection. And you can see from the testing table there that the standards do offer slightly incremental increase in impact protection. Now, every other equestrian sport in the UK has to wear a level 3, so the most protective and therefore the most bulky garment. Whereas in racing, we stipulate that the jockeys need to wear a minimum of a level 2. Now, the transition we made from a level 1 to level 2 in Britain occurred on the 1st of October 2018, and in Ireland they made the change from the 1st of January 2017. So many of the jockeys within the 2 studies actually do remember and did have the experience of riding in the level 1 garment as well as the level 2. Just a word specifically on impact testing. This at the moment is done by independent testing houses, and it's done on a rig where they measure the energy transfer with the flat iron and also with a narrow bar penetrator. The narrow bar is supposed to sort of simulate the toe of a horse, so during a kick. Now, the obvious here is that, they are lab conditions, and to an extent you have to sort of question the real world sort of testing procedures here, and do they actually do they represent the conditions under which the garment has to perform during real world scenarios. So up until very recently, this was the only level 2 garment available from a UK manufacturer. So this is the Race Safe Pro Race Level 2. No other manufacturer in the UK will make anything to a level 2 standard, because there is deemed not enough of a market, whereas all of the other, as I said, all the other equestrian sports use a level 3. There is also the Viper level 2 that is licensed to the beta standard EN 13158. For the jockeys, there's a very small percentage of jockeys that use one in the UK, and these are jockeys that have ridden in Australia and they've been able to actually acquire one with ease, rather than sort of guesstimating what size they would need and buying it online, because this has resulted in poorly fitting and then dissatisfaction with that garment. So you can see the front and rear panels there. If you just sort of draw your attention to the back panel, where you can see it's segmented up until the mid-thoracic region, and then you've got those longitudinal panels down towards the lower back. And I'm drawing your attention to that for a good reason, which will be sort of explained further. The white straps to the top right, they are leg straps, used predominantly amongst jump jockeys to anchor the garment down around the thighs and prevent the race tail from flipping up or from coming out of their breeches. And then the bottom left, those are shoulder pads. I don't think I've ever, in the 13 years I've been working in racing, I don't think I've ever come across a jockey that's actually used them. But there was some historical research that showed that they did actually reduce the incidence of shoulder injuries, but that was done in eventing. So in order to understand how jockeys are using their safety wear in Britain, study 3 is a mixed methods study which involved a quantitative survey and then qualitative semi-structured interviews to really pull out and gain an insight into the jockeys' experiences, perceptions and preferences when it comes to the use of their body protectors and safety wear, and also look at their safety, look at their attitudes towards injury risk and subsequent safety behaviour. I might just add that this is, from my knowledge, the first end user engagement of this kind in the UK. The quantitative survey, which contained predominantly closed questions, was initially distributed electronically to all professional jockeys licensed. The initial uptake was poor. This was done during one of the COVID lockdowns, where we were unable to have direct contact with the jockeys. And I think they were quite surveyed out at this point, because it seemed like everybody was sending surveys. So as soon as racing resumed, we were able to get hard copies on the race courses and at the 3 residential rehabilitation centres where jockeys can complete them. And this really helped, particularly if there were any jockeys that had any difficulties or challenges with literacy. Now, the survey itself really sort of gleaned to identify any demographic information, injury history, their risk perception, so risk perception being risk of fall and injury whilst race riding and riding out, and then also safety wear usage under those 2 conditions. Because we only have the one, essentially we only have the one level 2 garment, we were also then able to ask specific questions about the race safe level 2, about the functionality, protective capabilities, likes and dislikes, and importantly, their preferences. Once we'd analysed this data with SPSS, we were able to identify sort of key areas that we really wanted to delve deeper into. So we structured the questions for the semi-structured interviews around this to really explore the topics raised in the survey in greater detail, specifically the safety wear usage whilst racing versus riding out, the reasoning behind their safety behaviour, and some of the modifications they admitted to, as well as their preferences for future design, again in relation to that level 2 garment. So this was done in person, in a confidential setting, and all interviews were audio recorded and then later transcribed for thematic analysis. So a snapshot of the results from the survey. We had 126 responses in total. And to the left there, you can see the injuries that were reported. These are very much characteristic of, or consistent rather, of the injuries reported in previous injury surveillance literature. So we were happy that there was consistency there, and it was therefore representative of the jockeys as a whole. So looking more specifically at the survey results, and just sort of cherry picking a few of them here to talk to you about these today. 72.6% felt that they were protected from injury during a fall. However, 46.4% felt that the body protector did actually prevent them from tucking and rolling during a fall. So, the garment should never impede the jockey from being able to move freely and protectively during a fall. Only 26.6% of the jockeys felt that their body protector was flexible, and half of the jockeys, so 50.8%, felt that their body protector was uncomfortable to wear. And then, concerningly, 64.3% of jockeys had not been fitted for their current body protector. So these were jockeys that may have been fitted historically and told that they were a flat regular or a flat long, for example, according to the sizing for that particular manufacturer. And then they just kept replacing their body protector with the same size, regardless of any changes to their body composition as seen with growth, or the responses to training, or potentially deconditioning post-injury. So, if somebody's not wearing the correctly fitted garment, that is massively going to impact their experience of that garment. Of the modifications that were reported, so there were some aftermarket modifications that were reported. The reasoning behind this was predominantly to reduce weight, improve the comfort and flexibility, and also to accommodate previous injury, which specifically was for the clavicle. Just to expand further, the first 2 points relating to weight and comfort and flexibility were reported predominantly by flat jockeys, and then the accommodating previous injury was reported predominantly amongst jump jockeys. So we followed up the survey with the semi-structured interviews and conducted 34 semi-structured interviews. You can see the demographics there for the jockeys that we did interview. There were 27 males, 7 females, 17 flat jockeys and 17 jump jockeys. And then regarding license type, 26 professional and 8 combined conditional or apprentice jockeys. Each interview lasted around 20 to 30 minutes in duration, so around 850 minutes of interviews. The interview audio was transcribed verbatim, and then using a thematic analysis approach as described by Vaughan and Clark, which is a 6-stage thematic analysis process. We basically look to see whether we could develop particular themes from the data. And we developed a codebook of 24 key themes and 100 sub-themes. And these were related to cost, specifics about the body protector, specifics about injury history, regulatory matters. So to give you a bit of an overview of the interview results, what we observed is that jockeys placed a greater importance on their helmets and their body protectors. And this had subsequent cost implications. So jockeys would pay up to and in excess of £1,500 per helmet, but really a maximum of £300 on a body protector. There was one jockey who commented that they would happily ride without a body protector, but would never ride without a helmet. Jockeys also reported, some jump jockeys also reported using padded neck collars, particularly those jockeys that had actually sustained a previous cervical fracture. One comment there is that they felt more secure. So a question here is, whether that jockey is wearing that protective, that sort of padded neck for support in lieu potentially of recruiting and retraining all of their cervical neck musculature. So this is obviously something that we need to look into further, because these garments, the padded neck collars, they're not licensed, they're not tested in any way, so we don't really know if they're a friend or a foe. When we look specifically then at risk perception and safety behaviour, all jockeys deemed that riding out, so work riding, was lower risk, and as a result they would tend to use their older body protectors and older helmets to ride out, because they were more broken in. These were often a lower level of protection, so a lot of them were riding in their old level ones, which I said obviously we stopped using back in 2018, unless the trainer stipulated. Now, some trainers would stipulate that their riders wear a level 3 for insurance purposes, and there were some jockeys that also admitted to riding out without body protectors. When it comes to modifications, weight was a significant driving factor to the aftermarket modifications, particularly amongst flat jockeys. And then when I look specifically at language used during the interviews, lots of jockeys referred to their body protectors as a back pad or a back protector. So there is really an education piece here, because as the body protector, as I explained earlier, is designed to protect your internal organs against blunt trauma and also your spine against transverse type fractures. But its primary purpose is impact protection. So that language there tells me that maybe there is a misunderstanding as to what the body protector is actually for. And then finally, the younger, less experienced jockeys seem to conform to examples set by older peers. Now in this picture here, those with eagle eyes can actually see that this jockey has folded up the race tail and secured it with a pin. And if you're really eagle-eyed, you'll also see that that garment looks quite slimline and maybe not as bulky as a standard garment. But that jockey is hiding in plain sight, having a TV press interview. So for study 4, we looked to see whether we could quantify what some of the jockeys had reported about restriction. So here we're looking to understand the biomechanical interaction between the jockey and the protective garment during spinal movement and sort of functional movement patterns of the spine and upper limb. Our initial plan with this study was to try and replicate or repeat a certain fall using a fall simulator at the British Racing School, but unfortunately during the COVID period it was irreparably damaged and removed. So we then had to sort of rethink our approach to this study. So we used the Qualisys motion capture system. So there's, from memory, there were 8 cameras. So giving us that 360-degree viewpoint of the jockey. So in that picture there, you can see that the jockey is fitted with lots of reflective markers on bony landmarks. And this was consistent for all of the jockeys that we tested. So we tested 22 professional jockeys and fitted these reflective markers on those bony landmarks, so we could really see how the body moved during these functional movements. Part of our design in this study was that the jockey also had to undergo a formal body protector fitting, just to make sure that they were wearing a garment that fitted them correctly. And each jockey also completed this study with a brand new body protector, so that there was no opportunity for a garment that may have broken in and become slightly more flexible through use to kind of impact the results that we were getting. So under separate conditions, so we looked at spinal and upper limb functional movements under a garment-free condition, a body protector alone, and then we also looked at the same movements with the body protector with leg straps or groin straps in place, so the accessories that are designed to sort of keep the garment down and in place. We also recorded a subjective effort scoring, so we used the modified Borg scale to sort of capture the ease of movement of each of the movement patterns. And we also recorded subjective comments regarding comfort and restriction. So to give you an idea what this looks like in action, the picture to the left, you can see a jockey fully marked up. The middle video, this is forward spinal, so flexion. And then the video to the right, this is actually what it looks like on Qualisys. So the motion capture system is calibrated to know the exact dimensions of that space, and it can therefore measure the displacement between the markers and indicate the movement of each segment and the overall range of movement of each of those segments, and obviously does it in a way that is more advanced than we can sort of do it with the naked eye. So when we look at the findings from the motion capture, we did identify that lateral movement or lateral flexion was significantly restricted in all the conditions. And the subjective findings also supported that jockeys felt quite uncomfortable as the front panel impacted the side of the pelvis and the hip during that lateral movement. Spinal flexion and extension, so bending forwards and backwards, were not significantly restricted. However, what we did observe is that the movement patterns utilised to achieve the same range of movement altered between the body protector alone and then the body protector used with the groin or leg straps. And what we saw was that there was more tilting of the pelvis, almost to compensate for the lack of segmental spinal movement that was viewed either with a garment free or with a body protector alone. So it does sort of raise the question whether the leg straps and the groin strap are anchoring the garment down, but obviously in this, in these stand-in spinal movements, it wasn't actually restricting their movement. 8 out of 22 of the jockeys that we tested needed some customization to their garment. So this here is, the RaceSafe Level 2 is an off-the-shelf garment in set sizes, and 8 of the jockeys that were tested needed either their front panel extending or the back panel, shortening, and it sort of supports the need for maybe some made-to-measure models, or certainly more availability of sizes or a wider range of sizes. The obvious flaw to this study is that, these are just standing functional spinal movements and upper limb movements. They aren't dynamic. We would have liked to have done more dynamic analysis, but it's not possible when using a marker-based motion capture system, because as soon as you try and move the markers, obviously they do come off. We did do a riding simulation, but we were struggling to then interpret the results because some of the markers would be dislodged, or often the body protector would creep and obscure some of the markers, and then it would make actually quantifying the range of movement at that segment very difficult. And the movements obviously had to be done in a standardized way in order for reproducibility between each of the jockeys. So the outcome, I guess, from studies 3 and 4, which is the end user engagement and the spinal kinematics, sort of prompted us to engage with the manufacturer of the ProRace Level 2. So we engaged with RaceSafe. We went there with our feedback and worked with them to develop what you see on screen, which is the RaceSafe Race Motion 2 body protector, which conforms to the beta standard of EN 13158 Level 2. And the key sort of characteristics here and the key changes that were made. One, the foam is generally lighter. So I think a standard Level 2 is around 540 grams. This is slightly lighter. So to kind of address the issue that flat jockeys were experiencing with the weight of the garment. We also requested that they taper the sides. So you can see from the picture furthest on the left that there's an angulation to the side panel, and you can also see it from the picture furthest at the right that the front panel is shaped slightly. Oh. And this is so that when they do that lateral movement, the garment doesn't impact the top of the pelvis, and therefore doesn't restrict the garment, the jockey rather, for any lateral movement. The back panel is now segmented, and this allows the garment to contour better to the form of the jockey and move more freely through flexion and extension, or certainly subjectively move more freely. And then the foam that sits over the clavicles is made of a sort of softer memory foam, which softens further to in response to body heat, and is reported to be significantly more comfortable. RaceSafe has also made this garment in a wider variety of sizes, and will also make modifications so that garment is essentially more made to measure for a particular jockey. So this is actually available now, and what we've seen are jockeys that are transitioning over to this garment are reporting increased satisfaction with it. So just some wider thoughts regarding safety wear. I think it's essential to ensure that a jockey receives a formal fitting for each new body protector, so that improved fitting will ensure that they are more comfortable and more satisfied, and therefore slightly more compliant. There's also some indication that the manufacturers should consider retesting their garments to make sure that the garments are sort of maintaining their protective capabilities, and also to sort of clarify the project durability. So at the moment, there's no clear guidance on how long a jockey should be in a body protector. They say 3 to 5 years, which is quite broad, for the use of a body protector. But remember that a jockey is using the garment day in, day out. So I think, there is a responsibility of manufacturers to identify actually how long a garment actually maintains its effectiveness for, because the PVC nitrile will degrade with time and with use, and obviously with impact. Just on the topic of impact, very few jockeys actually would inspect their body protector after sustaining a fall. And the problem with the body protector is that the foam will conform back to its previous shape over time. So the garment really does need to be inspected as soon as possible. And in the case of a stricken jockey, the focus is very much on stabilizing them and their health. So perhaps, it could be brought in that a member of the support staff on that day will inspect the garment within a 30-minute period to make sure that there are no obvious signs of damage, or that the foam, for example, hasn't misshapen. The survey and the interviews identified that there is a knowledge gap, and jockeys do need some education to sort of better understand the role of their safety wear and therefore their expectations, because this will also improve compliance. And it seems very obvious, but when a jockey is being coached, or a jockey coaching is undertaken, they should really wear their safety wear, because this will encourage habituation, so they'll get used to the garment, but also when they're trying to achieve those technical competencies, they can do so with the garments in situ, and they do not feel, or should not therefore feel impeded by their garment. And as I touched on earlier, further research into the use of leg straps or groin straps, accessories in general, should really be examined further, because in my mind, if the garment is anchored around the thigh and obviously fixed at the shoulder, and this material doesn't stretch lengthways, then this is likely to impair potentially, or certainly, as we've seen from the kinematic study, it does increase the effort required in order for the jockey to be able to move freely. So whilst it doesn't restrict their movement, there is certainly the subjective feeling of restriction. And also I touched on the need to further examine the use of padding neck collars. So thank you for listening. A bit of a whistle-stop tour of the research, and I hope to get the remaining papers out so that I can really share the greater detail with you. Also going to be a bit busy for the next couple of weeks, months, but please do get in touch if you've got any feedback, or if you'd like to engage regarding the research. And thank you once again for inviting me to talk with you today.
Daloni, Lucas, there are our thanks to her. We are going to really get our value from Dr. Jennifer Pugh and Dr. Jerry Hill, if that's okay. We've had a couple of questions come in, and we're going to get Daloni joining us here shortly. Get Jerry and Jennifer back up if we can. We had a couple of questions come in subsequent to our chat earlier, which we can ask you, and also I'm sure you have some input on the analysis and prevention of spinal injuries in horse racing that Daloni ran us through so eloquently. So while we try and get Daloni up, what I might do is just return to some of the points, some of the questions that came in earlier on for Jennifer and Jerry, if that's okay. First of all, We had this from Barry Geraghty. Thanks, Barry, for this. He said, thank you for a really good presentation. Jennifer, this probably can come to you first on this. Using the Patrick Mullins case as an example, that was the one that you mentioned where he'd had a fall and then didn't remember subsequently riding in the bumper. Does this highlight the need and benefit to have the weighing room space as open and accessible as possible rather than splitting up areas with partitions, etc., which would possibly limit fellow riders, valets and doctors' opportunity to recognise delayed concussion?
I think anything within any area that the jockey is using during a race day that is where you have as much oversight, I suppose. I mean, the weigh rooms have to be a secure and safe place for jockeys. There's been a lot of talk in recent times about the valets and their responsibility. I would say to a valet, they're not trained professionals, but to Jerry's point earlier, education, because they're the close contact and they know their jockeys well. So I certainly think education within the weigh room might be more important than necessarily the division of the space, but there's a huge kind of push to open up recreational spaces for jockeys, that they're not sitting on hard wooden benches and among dirty saddles and sweaty gear during racing, but that does sometimes take them away from colleagues. I'm sure you know most jockeys, when they go into the weigh room, tend to sit in the same place and they're familiar with the people beside them, and that is a really key part of this. I think probably the key piece is the education of everybody within that weigh room, that at any point when they come into contact with a jockey who might be concussed, they have their radar and their antennae up.
On education. Did you want to add anything to that, Jerry? Not necessarily.
Yeah, but I would agree. I think actually the issue is the knowledge that the group of individuals in that area has about the significance of what they're seeing and whether or not that should be reported to a medic or not. I could certainly understand the argument, say, if there were closed cubicles and someone was locked in behind a closed cubicle, clearly they are isolated. But actually our experience tends to be that fellow jockeys, valets, and indeed some of the stewarding staff knew that individual wasn't quite right, but didn't take it to the next step. And I think that's the key thing, is that knowing what to do with that knowledge would be the more appropriate approach.
Please do keep those questions coming in through the online platform. Our thanks to those. We welcome Daloni Lucas. Hello, thanks ever so much for that. The first question is, how are you feeling?
Big and still very pregnant.
Well, look, thank you very much for that. That was hugely insightful and enjoyed by everyone here and online. We'll kick off with a couple of questions that I have in front of me. Actually, one of them, Daloni, relates to the point on education that Jerry and Jennifer were touching on there. Have you, in your research, found jockeys to be curious about the latest information when it comes to spinal injuries?
Absolutely. I think what we're seeing is a new wave of jockeys coming through that are very much looking at the next thing in technology, equipment, design, ways to improve their performance. So certainly this study did generate a lot of interest, and obviously having the benefit of working on the race courses, I did have jockeys just approaching me, asking and engaging and suggesting. So I'd like to think that whilst there were 126 survey responses and 34 interviews, actually the research does represent the jockeys as a greater whole, because they were all very engaged and sort of very keen to give their stance. Because remember, safety wear is something that is mandated, so they wanted the opportunity to have their say.
Please, Jennifer and Jerry, if you wanted to jump in on anything, please do. Don't wait for me. But if I can just tie that in with what we were talking about earlier, do you think that, both of you on the floor here, spinal injuries are something that jockeys may be a little bit more front-footed to speak about, because it's, I guess, the immediate threat of injury is more obvious than perhaps a head injury, Jerry?
I don't know is the honest answer. I'm not sure there is a great difference to that. I think most jockeys are interested in not being injured and being back at racing as soon as possible in a safe fashion from whatever their injury turns out to be. There is no doubt that actually, if you have a fracture, whether it's a spinal fracture or a fracture elsewhere, it is evident, it is obvious. And certainly the challenge always with concussion is that sometimes people look fine from a distance, and that means they are often challenged and questioned as to why they are not riding or riding out when they apparently look normal. So I think that would be a difference, whereas you're not going to ask someone on crutches to say, would you mind just riding out tomorrow?
Yeah, because the more obvious barrier. Daloni, how important is access to quality safety devices such as body protectors and helmets for jockeys? And if I can just elaborate a bit on that and talk about the globalization of the sport, when jockeys are riding in different jurisdictions, how important is it that there is consistency on that front?
Well, there are obviously there are many different body protectors, for example, used at each racing jurisdiction. One body protector, for example, that was very well liked amongst our British jockeys was the Descente. And this is a very sort of slimline garment that only meets the previous standards level 1, so therefore they can't ride in the UK with it. But it was certainly, it's covered in a sort of elasticated mesh. It's very flexible. It actually doesn't feel like you're wearing anything. But with our current standards, we therefore have to sort of question, does it offer the safety protection that they need? And certainly, whilst there are going to be differences between the way that the racing in different jurisdictions, for example, how tight the field of horses run in some countries compared to over here, there are going to be slightly different risk factors, but the mechanisms are going to always be very similar, and certainly a kick is going to be a kick. And therefore, excuse me, there needs to be that level of impact protection. So I think, learning about what the jockeys want and what the jockeys like, but then also this research and other research looking at what the jockeys need. And this brings me back to educating the jockeys about what their safety wear is for and what it's protecting them from. If they're on board, they're going to be more compliant. And then, hopefully we'll see that the racing across all jurisdictions will be more safe, because the standards will be higher, or there will at least be some parity.
Don't have to. Anything you want to add? No?
I mean, one point which I'd just like to make, and interesting, Jennifer alluded to it in her talk on concussion, and that is to do with fitting. And that's the point which came out very clearly in Daloni's talk, that actually the best safety equipment is not necessarily the most expensive or the most protective in a laboratory, but it's the one that fits you well and that you are comfortable wearing and you will wear consistently, and ideally does not alter your movement patterns. So I think that's a really important point, that actually you should be fitted for it. One of the challenges we have with helmets is that sometimes manufacturers will alter the fitting of a helmet, but it will be called the same thing. And that's a real challenge, because actually I bought this helmet last time, I'm going to buy someone online this, it doesn't feel the same. So I think whilst it's a big ask, I think it's really important that actually for any safety equipment, you go and are measured by someone who's had the appropriate training in the fitting of that garment, whether that's a body protector or a helmet, so you are giving yourself the optimum protection. And remember, price and a nice colour doesn't necessarily make it safer.
I was just going to add that the challenge is always, as soon as you add in protective equipment to protect somebody, the challenge is that you may alter flexibility and how somebody moves. And Dal has to be highly commended on this study, the first one really, to look at how people move in body protectors and race safe in particular in our jurisdictions, where they've been very amenable to changing the garment. And the feedback currently from the jockeys that we have who are transitioning into the race motion too has been very positive. But the challenge, just to go back to your point on internationally and trying to harmonise rules, is there's a big difference in those countries who don't necessarily have jump racing, therefore don't have the same exposure to falls and injuries, because we know how it is particularly uncommon, thankfully, for a flat jockey to have a fall. But we know when they do fall, they are the injury rate is much higher and the injury burden is much higher. So while you may not fall very often as a flat jockey, when you do fall, your likelihood of being injured is very great. But I think that message gets lost. If you ask in Dal's survey the jump jockeys how they feel about a body protector versus a flat jockey, you'll get a very different answer, because a jump jockey would not, it'd be like driving a car without a seatbelt. They absolutely know the benefit of the body protector because they're falling so frequently, whereas a flat jockey more likely sees that it's affecting the weight and it's restricting me because they're not falling every day. Well, hopefully jump jockeys aren't falling every day, but they're not falling at the same rate. So there's definitely a huge difference, in my opinion, between high racing jurisdictions where there's predominantly flat jockeys versus those of us who are dealing with jump racing.
And the research would support that, very much so.
Daloni, what are the best ways, in your opinion, for the sport to help continue jockey education when it comes to preventing spinal injuries?
Good question. So we're hoping that with the work that James is doing, we're going to at least try and identify an optimal way of falling. But I think the research thus far has certainly shown us a suboptimal way of falling. And I think in terms of jockey education and training, we can't really sort of say specifics, this is how you should fall, because every fall is different and the jockey has to respond to the certain circumstances that are occurring at that time. But I do think that jockey education and falls training, or movement training, shall I call it, should be about a jockey acquiring their general movement capabilities and having that athletic ability, sort of refining their body awareness, their kinesthetic awareness, so they've got that athletic ability when they do fall. And obviously, if a jockey is more physically conditioned and robust, they will be able to take those impacts. So I think a lot of the work needs to be done sort of preparatory. Jockeys need to have that fitness, they need to have that body awareness, and they need to be fit to fall. And obviously, that's one of the requirements of being a jockey. It's not just about the riding.
We've had a question in from Gillian online, and I promise I will come to that. But just to elaborate a bit on that, we've seen this consistent theme now of a way in which a rider should fall most effectively. It's something both Daloni and Jennifer in your segment you touched upon. You mentioned that there has been some training for jockeys on how the best practice on how to fall. Is that ingrained now in a program? It's not.
No, we're very much at a kind of exploratory phase. This was in the Racing Academy. They did a session with the trainee apprentices. So it's something that we're hoping to look into, because I do think, and I know we've had different speakers at previous conferences talk about the ability that you can, with muscle memory, train a jockey how to fall. And it's about the tumbling technique. I had this conversation with our colleagues from Japan just at the coffee break, where they have a great background in judo. So that flexibility, that being able to roll, being able to land not on an outstretched arm or with the second impact being on the head. And the guys that come in to do the falls training, like, you're just looking at it going, this is light bulb moment. This really makes perfect sense if you can get someone to fall and roll as opposed to fall and land with that deceleration. So, but we're very much at early stages with this.
And I guess, as Daloni was touching upon in her presentation, to recreate those circumstances in a teaching environment is nigh on impossible. So I guess that's a huge difficulty. Feel free, anyone to.
I was going to say, I think absolutely recognising when a fall becomes inevitable and falling in the optimum way is going to be an important asset. But I think we need to be taking a step back, because one of the things we have seen is a drop in fall rates over recent years. And that's very interesting. So perhaps we really need to explore how we can reduce the number of falls, and when a fall becomes inevitable, how to minimise the injury associated with that. And so that involves looking at a range of factors. Clearly there are jockey factors, and as Daloni has mentioned, the increased athleticism and fitness and preparation on a race day to do your neuromuscular warm-up. Yes, we spoke about it in the context of concussion, but it's also in terms of other performance. And we see that in other sports. I mean, laughingly, and we don't see this very often, warm-up historically for jockey was sitting down, reading the Racing Post and having a fag. We've gone beyond that, but I think being prepared to perform, being prepared to race is really important, because it will reduce your fall rate. But it's not just about the jockeys. You know, there have been improvements in the construction of jumps. The racing surface has improved. I'm not a vet, I don't know anything about horses, but of course clearly horse choice and horse quality will come into this as well. So absolutely, let's teach our jockeys to fall in a safe way, but let's not accept that falling is an inevitable part of our sport. Yes, it's common, but let's see if we can reduce the risk in a more global fashion rather than just concentrating on the athlete.
We'll come to the floor, I promise, and there's still a question online we need to answer. But that's something I noted during Daloni's presentation there, which you've just hit upon, preventing falls itself. Does it require dialogue throughout departments in the BHA, the IHRB, etc., to ensure that factors like, you know, horses that perhaps shouldn't be on the track, or the correlation between inexperienced riders and inexperienced horses teaming up, that should be looked into to avoid, to lessen those fall rates? And is that something that's currently taking place?
I think certainly collaboration across the board with our clerks of the courses and how the race courses are produced with our equine veterinary colleagues. One of the positives in Dal's study for me was that there were no other modifiable risk factors when she looked at all of the epi variables. So it looks like we're probably doing something right here. The ground conditions, the horse type, the jockey's previous injury, the conditionals or the apprentices we might have expected weren't highlighted. Horses of a particular age weren't highlighted. So that to me is a positive. It makes it more difficult because now we have to work on the biomechanics as the only modifiable factor here. But I think there's a lot of evidence there that we're getting a lot of this right. But absolutely linking this in with the equine injury projects is going to be really important going forward.
I'll open it up to the floor now. Any questions for Daloni in particular? Yeah? Microphone on its way.
Hi, Daloni. Duncan Law here from Changing Minds and the Injured Jockeys Fund. I'm a clinical psychologist, so my interest is in the mental impacts of this. And there's two things. One is the video that you showed of that horrific injury. There was a real palpable reaction in the room, and it made me think, you watched hundreds of those and you're a research assistant. I was interested in the impact of that on you. But also interested in, you mentioned risk perception as a factor in terms of jockeys' willingness to wear effective body protection. And I was also wondering whether you'd thought of looking at other psychological factors in terms of fall prevention or injury. We know that in other elite sports, there's quite a strong correlation between stress and sport injury.
Hi, Duncan. So to your first point, initially it was actually pretty stressful, I'll be very honest, watching the falls. Now, having worked in racing for 13 years, I'm pretty used to watching them fall. I would say that probably the most triggering factor was watching the horses break down. Because when I'm working, you know, my working as a physio on the race course, my focus is very much on the jockey. But, you know, when I was conducting this research, there was no actual getting away from analysing the horse. And I think that also, that's what the public will see as well. So I think, you know, it was stressful, but you sort of almost desensitized to it. And I think that also applies to jockeys. They do see their colleagues fall quite a lot, so they are accepting of those falls. Something that we used to do when I worked with the Injured Jockeys Fund, once a jockey was injured, their final phases of their rehabilitation was the falls training and actually getting them used to the movement patterns and actually teaching them that they didn't need to be afraid to take contact on that body site that was injured. So I think that still has an important part to play when it comes to that final return to riding rehabilitation, that final phase. Regarding the jockey's risk perception, when I looked at the transcripts, one word that came out pretty much with every jockey was luck, and I felt lucky. So I think, you know, they acknowledged the risk and they almost put down when they have a fall and they don't get injured, almost to luck. But actually, comes back to the education and training, it isn't just luck. They were potentially ready to fall or were able to absorb that injury mechanism. So I think, when the jockeys, or when you're exposed to the falls regularly, there is almost a level of acceptance, and they're sort of desensitized. In the circumstances where a jockey has had a fairly significant fall, because they are going through in Britain, they go through the process of rehabilitation with the Injured Jockeys Fund, and they do have that multidisciplinary team working with them. So they do have access to individuals like yourself that can address any issues that may arise as a result of their falls and injury. So it's education and training, but also having the multidisciplinary support available to them.
Yeah, go on, Jerry, if you want to.
Can I ask one fairly specific question? So going back to, I think it was your first study, looking at the biomechanics being one of the factors that were most amenable to adjusting if we can. And actually the issue about head impact being a key factor in association with spinal injuries. So it makes one think, and I'm partly saying this because I've got a meeting with helmet manufacturers next week, whether or not the helmet has a role in perhaps in at least accumulating data to start with. So actually, do we now need to move towards instrumented helmets in some fashion in order that we can actually measure these impact forces? Because that will then give you some nuance about impact angle, whether the force could be dissipated. And actually, does the helmet have a role in dissipating the force so it is not then transmitted down in an axial fashion down the skeleton? So in simple terms, if we get the helmets right, do you think that will reduce spinal injuries?
Well, certainly the observed mechanism, when the jockey impacts the head, the energy dissipates down the spine, and then that failure occurs further down the spine. So if a helmet were designed to dissipate the energy, perhaps it wouldn't travel so far down the spine. I think this points to more research needing to be done. One thing that I picked up with my research was the interaction between certain helmet types and the body protector. So some models of jockey helmet have padding or sort of around the base of the neck. And when a jockey is in extended position with the head and neck, often there is contact between the top of the body protector and the bottom of the helmet. So I think this also needs to be explored further, because clearly it's blocking the jockey's natural movement. So I think it points to, yes, the helmets could dissipate force and energy transfer. So we're not seeing so many of these indirect thoracic fractures. But generally, the researchers, as with most researchers, pointed that we need to look at perhaps the interaction between the body protector and the helmet as well.
That's brilliant. And at the risk of hogging the floor, can I just ask one supplementary question? And I didn't see it, and apologies if you put it up and I didn't see it. What about surface type? Because certainly if you look at the reports we get from jockeys riding on the all-weather, is that the deceleration characteristics they report are radically different to riding on turf.
So sudden deceleration was the second most predictive variable when it comes to spinal injuries. With this second phase of analysis that we're currently working on is picking out these specific variables and risk factors and having a look at the odds ratios when we look specifically at those key variables. So I will hopefully be able to answer this in more detail once we've done this analysis, but certainly when a jockey falls on that synthetic surface, they tend to stop more suddenly. And this is obviously what we've observed, and I'd be able to give you the facts and the figures to really back this up in due course.
That's brilliant. Thank you very much.
Anything else from the floor? We have one more that came through from Gillian Burke on the meeting, so thank you very much. This did come earlier on, so it relates to concussion. Gillian asked, will technology play more of a part in the initial diagnosis of concussion in the future, do you think? I guess, Jennifer, that relates to those initial assessments being technology not really being involved, but seeing the jockey moving up and down in your visual assessment.
Yeah, I think technology certainly will. There's the practical kind of in-house stuff that we can do in terms of monitoring and watching the fall footage. But technology is probably the one that's of most interest. Is if the biomarkers, the salivary biomarker tests ever come, there's lots of research going on there that you'd be like doing a COVID swab and doing a test. That might contribute to your findings rather than give you a definitive answer. But I think there's a really exciting space there. The consensus statement really just says we're not there yet with any of these markers, and there's lots of genetic studies been done as well. So I think it's down the line, I think we will certainly have more of that section that we crossed out the laboratory tests because we're not there yet, but certainly into the future I think that will be playing a key role.
Daloni, is there anything else that you wanted to add at this point? No, you don't have to. I just wanted to check because we're saying goodbye.
The computer says no.
Good, fine. Daloni's like, I'm done. Thank you very much.
Tom, can I just say something?
Yes, please do.
I just want to commend Daloni on the work that she's been doing here because it really has been extraordinary. It has really transformed our approach to this analysis of injuries. And I think, I would really like us to put your hands together and thank her very much for everything she's doing.
Thank you very much. And thank you for your support, Jerry and Jennifer, throughout this.
Daloni, thanks ever so much. Really appreciate it.
Thank you. Have a good day.
We are at the lunch point, which is good news, I'm sure, for everyone. So you can all make your way out and have some lunch, except, of course, for the two of you who have to stay in these seats forever now. I apologise. But yes, thanks very much. We'll take an hour's break, so we'll come back then. Cheers.